If you have to pee urgently, but then stand at the toilet bowl waiting for your body to begin, you may have a prostate problem. And the strangest part is that your prostate doesn't even produce or store your urine, just positioned in exactly the right place to ruin the entire operation. The prostate wraps around your urethra, which is the tube that urine travels through. It runs from your bladder to the terminal end when it leaves your penis. When the prostate enlarges, that tube can get squeezed. This is called BPH, benign prostatic hyperplasia. It isn't cancer, and it's extremely common. And it can turn peeing into a part-time job. So that explains the weak stream, but it doesn't explain why you suddenly have to pee like it's a national emergency only to produce 3 tablespoons. For that, we need to talk about what your bladder has been doing behind the scenes. Your bladder has been working overtime. Your bladder has essentially been working for an incompetent manager. Every time you urinate, your bladder muscle has to work harder to squeeze urine past that narrowed opening. At first, it compensates. It works overtime. It doesn't complain, but eventually it can become thicker, more irritable, and less efficient. That's when you may start getting urgency, frequency, and that undeniable feeling that your bladder is screaming, "We have to go now." You rush to the bathroom, wait for the stream to start, and then urinate with all the force of a decorative fountain. And you may still leave urine behind. The leftover urine helps explain why you can walk out of the restroom, sit down, and need to pee again before you've even found the remote. But the symptom that finally drives many men to the urologist's office isn't happening during the day. It happens at 12:30, and then 2:15, and then 4 o'clock. Why are you up peeing all night? This is called nocturia, waking from sleep to urinate. Once might be annoying. 3 or 4 times means your bladder has enrolled you in a sleep deprivation study without your permission. You wake up, get out of bed, shuffle to the bathroom, wait for your prostate to approve the transaction, produce an amount of urine that does not seem worth the journey, and return to bed. And just as you're falling asleep, your bladder announces another meeting. BPH can contribute to nocturia because you're probably not emptying your bladder efficiently. If you're starting the night with urine already left behind, it takes less time for your bladder to feel full again. An irritated, overworked bladder may also start sending the full signals before it's time again. And here's where things get interesting. Getting up at night does not automatically mean that your prostate is the problem. And this is where men can spend years blaming their prostate for something it didn't do. It might not be your prostate. You might make more urine at night because you're drinking a lot in the evening, especially alcohol or caffeine. Fluid that has collected in your legs during the day can return to your bloodstream once you lay down at night. And suddenly, your ankles have mailed their excess fluid directly to your bladder. Diabetes can cause frequent urination. Some medications, especially diuretics or water pills, can increase urine production. Sleep apnea can contribute to nocturia. an overactive bladder, a urinary tract infection, bladder stones, and other conditions can also cause similar symptoms. And constipation can make the entire neighborhood worse. A rectum packed with stool occupies space and can put additional pressure on the urinary system. Your pelvis is valuable real estate. Nobody down there needs a storage problem. This is why symptoms alone cannot tell you with absolute certainty that you have BPH. So how does a healthcare provider figure out that your prostate is actually what's responsible? And are you about to receive the exam you've been actively avoiding since 2007? What happens at the urologist? First, your provider is going to ask questions. How often are you urinating? Is your stream weak? Does it stop and start? Do you strain? Do you feel empty afterwards? Has there been any urgency, leaking, burning, or blood? These questions may be part of a formal symptom questionnaire. This isn't meaningless paperwork. Your answers help measure how severe the problem is, and more importantly, how much it's interfering with your daily life. You'll probably be asked for a urine sample to look for things like infection or blood. Your provider may order a PSA blood test. PSA can be affected by several things, including prostate enlargement, inflammation, and prostate cancer. It isn't a simple pass or fail cancer test, so the result has to be interpreted in context by your provider. And yes, your provider may recommend the digital rectal exam to assess the prostate. I know, this is the point where some men decide that they're going to make peace with waking up 5 times a night. But the exam is generally brief, and your providers are not going home at night to discuss your prostate over dinner. To you, this is a major personal event. To us, it's Tuesday. Depending on your symptoms, your provider may check how much urine remains in your bladder after you've urinated. This is called a post-void residual, and it's non-invasive. It's measured with a quick bladder scan. Basically, you pee, and then the machine checks whether your bladder agrees that you peed. Because you may walk out of that bathroom feeling finished, while your bladder is still holding half the meeting. Your provider may also check the strength of your urine flow, or order other testing depending on your symptoms. But let's say the prostate really is responsible. Does finding an enlarged prostate mean that you're headed straight for surgery? Absolutely not. And your first treatment may involve changing what you drink and when you drink it. But before you cancel coffee, beer, and every other enjoyable beverage in your life, let's talk about what actually helps. Can you improve BPH without medication? If your symptoms are mild and they aren't seriously affecting your life, your provider may recommend watchful waiting. That does not mean that everyone gathers around and watches your prostate expand like a gender reveal party. It means monitoring your symptoms while making a few changes that may reduce them. Try drinking less during the few hours before bedtime. Not less fluid all day. Dehydrating yourself is not a prostate treatment. Caffeine and alcohol can irritate the bladder and increase urine production. So, pay attention to whether they make your urgency or nighttime trips worse. And before bed, try double voiding. That means you urinate, wait a moment, relax, and try again. Do not bear down like you're trying to launch the prostate out of your body. The goal is simply to give your bladder another opportunity to empty properly. Some cold medicines, decongestants, and antihistamines may also make urination more difficult. Don't stop prescribed medication on your own, but ask your healthcare provider or pharmacist whether anything you're taking could be making your symptoms worse. These changes may help, but what if you're still planning every road trip, restaurant visit, and round of golf around bathroom availability? That's when medication may enter the conversation. What do BPH medications actually do? One common group is called alpha blockers. Medications such as tamsulosin, also known as Flomax, relax muscle around the prostate and bladder neck, making it easier for urine to pass. These medications may work relatively quickly, but they don't actually shrink the prostate. They can also cause side effects, such as dizziness or problems with ejaculation. That dizziness matters, especially when standing up for one of your 2 a.m. bathroom visits. So, don't leap out of bed like the house is on fire. Sit up first, relax on the edge of the bed, get your bearings, and then continue to the bathroom. Another group of medications, 5-alpha reductase inhibitors, such as finasteride or dutasteride, can gradually shrink an enlarged prostate. But gradually is the important word. This is not a take one on Tuesday and pee like a racehorse on Wednesday situation. Improvement may take several months. These medications can also cause sexual side effects, and they affect how PSA results are interpreted. So, your healthcare provider needs to know if you're taking them. Some men benefit from a combination of medication. Tadalafil, also known as Cialis, may be an option for certain men with BPH symptoms, particularly when erectile dysfunction has also entered the conversation. But what happens when medication doesn't work or you don't want to stay on it? This is where treatment has changed considerably. Does BPH treatment mean major surgery? Not necessarily. There are now several minimally invasive procedures that can help open the urinary channel by lifting, moving, removing, or shrinking prostate tissue. There are also surgical procedures such as a TURP or TURP that remove obstructing tissue to create a better pathway for urine. The best choice depends on factors such as how large is the prostate, which part is causing the obstruction, how severe are the symptoms, are you retaining urine, and how important is preserving ejaculation or sexual function to you. The last question is not frivolous or embarrassing. Different treatments have different effects, and your provider needs to know what matters to you before helping you decide on one. The point is that you have options. You do not receive one standard issue prostate procedure because you've reached a certain birthday, but there are a few symptoms you should not watch, wait on, or try to negotiate with at home. So, when is it an emergency? If you suddenly cannot urinate at all, especially if your lower abdomen is becoming swollen or painful, you need urgent medical attention. That may be acute urinary retention and your bladder needs help emptying. Seek prompt medical care for urinary symptoms accompanied by fever, chills, or significant pain, because infection may be involved. Visible blood in your urine also requires medical evaluation, and symptoms that are rapidly worsening. Repeated urinary infections, bladder stones, kidney problems, or persistently high post-void residuals can all mean the obstruction is doing more than ruining your sleep. Because BPH may be benign, but that doesn't mean that all of your symptoms should be ignored. So, if peeing has suddenly become an elaborate production, urgency, waiting, weak stream, stopping, starting, dribbling, returning for an encore, and attending mandatory bladder meetings all night long, please don't assume this is simply the price of getting older. It may be BPH, it may be something else, but either way, there are treatments, and you do not have to organize your entire life around where the nearest public bathroom is. Your prostate may have appointed himself the director of plumbing, but it does not get the final vote, too. I'm the nurse next door, and if you want straightforward answers of what your body and your healthcare team are doing, subscribe. And I'll see you in the next one.